Hello, I'm Dr. Joel Schwartz. I'm a chiropractor and I practice in Monroe Township, New Jersey. And today I'd like to spend a few minutes talking to you about a very common problem, and that is mid-back pain. What I'm speaking about is pain that you experience in the lower neck, upper back, and actually between the shoulder blades as well. This is a very common problem that people have. I want to talk to you about it in terms of what does it feel like, first of all. Mid-back pain can range from a very mild to very severe pain, sometimes between the shoulder blades. Sometimes you'll have pain when you take a deep breath, and I'll explain why that is in just a moment. It can also hurt when you cough or you sneeze. And sometimes people get very confused by this. It's actually kind of scary. If you take a deep breath and you experience a sharp pain, you may think that it's your lungs or your heart that's causing the problem. So now, what is the source of the pain? That's the next thing I want to address. The source of any pain always has to be some type of nerve irritation. Understand that nerves are what carry the sensation of pain up to your brain. So a nerve must be irritated in some fashion, some size of nerve. Now, what happens with mid-back pain is usually the muscles and the joints in the area back here get strained, and that actually irritates the nerves, and then you get the sensation of pain. Now, the next thing I want to address is what is the cause of the pain? What actually starts the process going? Well, there's several contributing factors. One of the most common is the fact that we spend so much time nowadays sitting at computers or sitting in a slouch posture with shoulders rolled forward and the head stuck out a little bit. That's called a forward head posture. And that tends to strain the muscles in the joints in the upper back, resulting in the nerve irritation. Another common reason is people have some degree of curvature in their upper back. What I mean is a mild scoliosis. Some people have a more severe scoliosis, but that can also be a cause of pain in the area. In addition, people can actually have a neck problem, a problem with some of the joints in the lower part of the neck, and that pain will radiate down into the shoulder blade area, but the cause is actually coming from the neck. So those are the most common causes of that type of problem. One other thing I should mention as well is some people have very poor exercise techniques. They've been taught to exercise their muscles in certain patterns, possibly emphasizing the front muscles here, the pecs and the deltoids, and not training the back muscles at all, or using improper exercise technique. That's another common reason I see for this problem. Now, how is the problem treated? Well, first of all, let me just show you this model here. I wanted to explain to you before about why it would hurt when you would take a deep breath. The causative factor in this problem are the joints here in the upper back and lower neck, okay? And please realize that all the ribs come in and attach here as well. So if my finger was a rib, it would attach at this joint right here. It would make a joint right here. Now when I take a deep breath in, if that joint is already irritated, it's going to hurt when you take a deep breath in. Also, if you cough or sneeze, you'll move your rib cage a little bit and you'll actually have pain at that joint as well. So now to the treatment. The treatment is to correct the problem. And this is usually a pretty easy problem to treat, and it takes a few treatments and you're done. We do chiropractic adjustments to these joints here and the joints with the ribs in the spine. We find the irritated joint, give you a few adjustments, and it usually alleviates the pain pretty quickly. In addition, what we try to show you to do is how to train the muscles in the area of your upper back, lower neck, and your posture so that you can decrease the strain on the area. So that's all I have to say. It's a pretty easy problem to treat. It is a little scary when you first have it if you don't know what it's all about. So if you need any help or would like any further information about this problem, please don't hesitate to call me or email me.